Good afternoon, everyone. Thank you for being here at She Shares today. My name is Tamara Torlickson with She Shares. For many of you, this is your first time joining us at She Shares. So to give you some background information, we are a quarterly conversation series that started in Sacramento, California in 2012, inspired by Maria Shriver's Women's Conference. Many of us miss the inspiration and connection we had attending those conferences. So we decided to create something similar where we could hear stories from groundbreaking women. Now in our 9th season, we have heard from some truly incredible speakers along the way. In addition to our conversations, we have a robust mentorship program that pairs young women just starting out in their careers with female mentors from our She Shares community. This year, we have over 40 pairs, and we have been staying connected during this time with virtual workshops on topics like networking, navigating the state appointments process, salary negotiation, and pay equity. All of this is made possible by our sponsors, many of whom have been with us since the very beginning. Before we get started, I would like to take a moment to thank each of them. Our founding sponsors, Thomas Law Group, Skelton Strategies, and Lucas Public Affairs. Our season sponsors, Kaiser, Sutter Health, Arrera Health Group, ARC Strategies, and Blue Shield of California. Chevron, Nimala Pappas and Associates, BMW of North America, Manat, and Calpine. Our event sponsors for today's event include the American Nurses Association of California and the California Biotechnology Foundation. Our partners are the California Center for Civic Participation, the Dewey Square Group, Torlickson Events, and Dry Bar. Our media partners are KCRA3, Comstocks, and Capital Public Radio. Thanks to each and every one of these organizations for their continued support of She Shares. While you are here today, be sure to subscribe to our YouTube channel and follow us on Facebook to stay in the loop on future events. As you listen to today's conversation, feel free to drop any questions you have in the chat box, and we'll get to them at the end of our program. And now let's get to the conversation that you have all joined us for. Dr. Nadine Burke Harris is California's first Surgeon General, appointed by Governor Gavin Newsom in 2019. The role of the Surgeon General is to advise the governor, serve as a leading spokesperson on matters of public health, and marshal the insights and energy of medical professionals, scientists, public health experts, public servants, and everyday Californians to drive solutions to our most pressing public health challenges. She is also an award-winning physician, researcher, and advocate dedicated to changing the way our society responds to one of the most serious, expensive, and widespread public health crises of our time, childhood trauma. Her career has been dedicated to serving vulnerable communities and combating the root causes of health disparities. She founded a clinic in one of San Francisco's most underserved communities, as well as the Center for Youth Wellness. She is also on the governor's task force on Alzheimer's prevention, preparedness, and a path forward, chaired by Maria Shriver, one of our past She Shares speakers. And last but certainly not least, Dr. Burke Harris is also a mother of 4 boys. Here to moderate the conversation with Dr. Burke Harris is one of our veteran She Shares moderators. Edie Lambert is an Emmy award-winning journalist who anchors weeknight newscasts on KCRA3. So let's welcome them both to the screen.
Tamara, thank you. And Dr. Burke Harris, thank you so much. I know during a pandemic, you have a lot going on right now. And, we're going to be talking about a big range of things from COVID-19 to childhood trauma to health disparities. But one of the things I have greatly admired about your work is that along these big range of issues, you come from a core place of value. So before we get to these specific issues, I would love to start with that kind of North Star and that place you come from as you approach all of these challenges.
Yeah, I think for me, going back to my earliest days, I think going back to honestly my experience as being an immigrant, being a what I call Jamaican Canadian, Jamaican American Canadian. And coming to this country from my family's Jamaican roots, really part of the fundamentals for me has always been easing suffering. And I've always felt a calling to address disparities in health outcomes, because as we see, when we look at the work of health disparities, we're really talking about differences in disease and death, right? So that means families who either get to have their loved one or don't. That means folks who either get to live out their potential or don't. And so I've really, it's always been for me, and I think really from my family background, very important to come to whatever work that I do from that sense of really trying to improve outcomes for those who are vulnerable and ease suffering in the world.
So with that in mind, let's talk about some of these numbers that are just emerging here with COVID-19. And I think at first glance, people would think, well, a virus just sort of hits where it hits. But if you look at some numbers, I saw these from you just this morning, that, well, 6% of Californians are Black, more than 10% of the COVID fatalities are in the Black community. And we look at the numbers just in Sacramento County, where I am, and the increases that we're seeing right now are in the poorest neighborhoods. And it's Blacks and Latinos who are hit the hardest. I know some of the ideas behind that is maybe that they're in areas where housing is more crowded. They're more likely to have been working on the front lines during the pandemic. Testing's not very available in these communities. So let's talk about what's going on with the health disparities that COVID has really highlighted.
Yeah, it's so when we look at the differences in COVID, morbidity and mortality, like the infections and the death rate, what we see is really the result of generations of policies and practices, right? Like when we think about the fact that Black and brown folks are more likely to be in, for example, service work, right? And we think about some of the decisions that were made in historically, right? Historical decisions and the way in which racist policies and practices now impact the way the jobs that people have, now impact where people live, right? If we think about, back, even for example, look at something like the GI Bill, right? Where the GI Bill gave funding for college for folks if you served in our armed services, except if you were Black, right? And how that, the ability of one generation to then get a college education and then be able to build something from their families, how that plays out in later on down the line when we're looking at the education, the housing, the opportunities that are different in different communities. And so that's one aspect of what we're seeing with COVID-19. And then of course, right, the other aspect of what we're seeing with COVID-19 is that the everyday experiences that Black and brown people have of discrimination, of racial injustice, those actual experiences get under our skin and change our biology. and they lead to increased activation of our biological stress response that can, over the long term, lead to increased risk of development of chronic diseases, right? Like heart disease and diabetes. And so we really see there are these kind of societal risk factors, but then there's also this very direct biological link by which racism itself is a risk factor for a person of color developing a toxic stress response.
And, bringing that back to COVID, you've talked about how a family where maybe the mom has been through a traumatic experience, that family will experience a pandemic in a different way than a family that doesn't have that kind of stress.
Well, that's actually exactly right. So what we see across California is that there are so many Californians that have experienced a traumatic experience in their life. When we look at the data about adverse childhood experiences, which was the big research study that was done by Kaiser Permanente and the CDC, looking at the 10 different types of adversities in childhood and measuring their effect on health, they actually didn't include racial discrimination as one of those original criteria to begin with, right? They were looking at things like abuse or neglect, or growing up in a household where a parent was mentally ill or substance dependent. And it was from this research, right, that we found there was this really strong association between adversity in childhood and lifelong health problems, risk of heart disease and cancer and other things. And what we now understand is that when folks have experienced high doses of adversity in childhood, that their bodies may be more sensitive to the effects of adversity, subsequent stressors as they get older, right? And that's something that I think that a lot of Californians are experiencing now, regardless of race. I mean, 62.7% of Californians have experienced some kind of, adverse childhood experience or some kind of traumatic event. And 17.6% have experienced 4 or more adverse childhood experiences, right? That's according to our data from the California Department of Public Health. So when we realize that those folks who have experienced, stressful or traumatic experience in the past, they may be having a harder time now with everything that we're going through, with COVID-19, with everything that's going on in our society, especially around issues of racial injustice. And then if you look at that and add to that experience of discrimination, right, you could see how that would increase the risk for health problems.
And I definitely want to talk to you about ACE, the adverse childhood experiences, which I have to tell you, when I first read about it, I thought, oh, those poor kids. And then I read the list and I'm like, oh, that's me. We've, so many of us have been through these things. But before we go there, let's just talk about how racism can affect biology, because I think that the discussion has, of course, been around economics. It's definitely been around mental health issues and maybe feeling depressed. But physiologically, that's something we don't talk about.
Yeah, I think that many of us kind of intuitively recognize that if you experience something traumatic, and especially during the early years, we call them the formative years for a reason, right? That can affect our risk of something like depression or substance use, right? So that I think the connection between early adversity and mental and behavioral health outcomes has been well recognized for a long time. Our mental health colleagues have been telling us about this for a long time. But it really wasn't until the Adverse Childhood Experiences study that was done now 20 years ago. So it's been a long time that we recognized that this, high doses of stress or trauma or adversity can increase the risk for things like heart disease, Alzheimer's, cancer, chronic lung disease. And interestingly, there's strong evidence to show that racism works much through the same pathway, which is the development of what we call the toxic stress response. And essentially, it is that repeated activation of our biological stress response that releases all of these stress hormones, right, in our brains and bodies. And these stress hormones have a positive effect in the immediate term if the stress is not repeated or severe or chronic, right? But when, so these stress hormones, they're designed to save our lives from a threat. But when that stress is repeated, when it's severe, when it's chronic, when it happens over and over and over again, then that stress response goes from being life-saving to being health damaging. And these long, high levels of these stress hormones actually affect, they harm our cardiovascular health. They increase our risk for inflammation. They increase our risk for heart disease and stroke and Alzheimer's, et cetera. And so this is what we are now learning. But the thing about it that I find to be really heartening, right? Because when you hear that, it can feel depressing, right? Like you can feel stressed just hearing about it. But what's really powerful is that now that we better understand the science, and I think this is something that's really cool to me as a doctor and a researcher, is that when we understand how something works, then we can use that understanding to help to do early detection, early intervention, and interrupt that biological process. And that's what we've been doing here in California. I am so excited to be leading an initiative called ACEs Aware, where we are actually helping to train our primary care practitioners, right? So, doctors and nurse practitioners and physician assistants and folks all across our healthcare spectrum to actually do screening, because this is what the science shows us. The science shows us the earlier you identify and the earlier you intervene, the better the outcomes. And so California has launched a first in the nation effort to train doctors to recognize risk factors for toxic stress, right? And also to understand the science of what we can do, right? How do we intervene with trauma-informed care? So it's very exciting. I'm excited for California to become a trauma-informed state.
So congratulations, because you have been working on this and fighting for this for a long time. So thank you for this work that you're doing. And let's talk about what's going on since the death of George Floyd and the protests that we're seeing. And of course, there's a lot of attention on police reform, but it goes way beyond that. And I'm wondering if you're seeing new energy, new commitment toward decreasing racism in general, but also some of these health disparities that you've been working on your whole career.
Yeah, so that has been, I had to kind of do a little reality check, right? Like I had to kind of just to see, is it just me? Because as you mentioned, I have been working on these issues for many years. But it really does feel like we are in a historic moment right now. And that really landed home for me when I participated in a discussion that was hosted by the California Department of Education. And I was, on this Zoom call with the superintendent of public education, Tony Thurman, and a bunch of youth, a bunch of teenagers, high schoolers. And we were talking about the significance of the moment. And we were talking about all of the things that they would like to see change and all of the ways that they are being, upstanders and participating in driving systemic change in their own in their own spaces, in their schools, in their lives. And I think I was never so inspired as listening to these high schoolers. And it really made me feel like, no, wow, this is real. This is a moment. It's more than a moment. This is a moment of a historic shift that we see is happening. And it makes me really excited.
So as our Surgeon General, and as you're talking to young people and all of us right now, what is your call to action for us in reducing these disparities?
So the thing about racism, right, is that, there's a great book by an author by the name of Ibram X. Kendi. It's How to Be an Anti-Racist. It's like at the top of the New York Times bestseller list. I think a lot of people, are reading this book. But one of the great things that he says in that book is that there's no such thing as not racist, only racist and anti-racist, right? In recognizing that the institution of racism is kind of built into a lot of our systems and structures. And so I think there's an incredible opportunity right now for all of us to be part of pushing forward an anti-racist agenda and doing the work of anti-racism everywhere we are, right? If it's at our kids' preschool, or we're at the grocery store, we're in our places of work, or we're even just looking at some of the, certainly for those of us in healthcare, there's a tremendous amount that we can do, but it's really looking at, where are my little places of influence? If it's even in the email that I draft, right? And what type of language that I use and how I communicate to the others that are in my environment. I think that's really powerful.
So I do want to go back to the ACE testing that is now being done and assessing children, but let's start with your book, The Deepest Well. I just had tears rolling down my face when you talked about a little boy who stopped growing. I mean, it doesn't get more profound in terms of a health impact than seeing a child just stop growing.
Yeah. So in The Deepest Well, I tell the story about my patient, Diego, who was a 7-year-old boy who came to see me. And he came to see me because he had, trouble paying attention in school and a hard time regulating his behavior. And he had asthma and he had some other things. But the thing that was really remarkable was, yes, that he was 7 years old, but he was the height and weight of a 4-year-old. And in looking at getting his history, looking at his growth chart, I noted that he had experienced significant trauma when he was 4 years old. And looking at his growth charts, it looked like he had simply stopped growing. And that was really the thing that, as a doctor, opened my eyes to how powerful our experiences are in shaping our biology. And what I try to do in The Deepest Well is really tell that story. It's really tell the story of, patient after patient after patient that I cared for at the Bayview Child Health Center, and how much they taught me a lot of the things that I didn't learn in medical school or residency. One of the things that I talk about was I was in practice, in my medical practice, before I ever learned about adverse childhood experiences and the impact that they have on health. And it really was my patients who, through their stories, and through my experience of becoming part of their community, of getting proximate, right? As someone who's a personal hero of mine, Brian Stevenson, he says, one of the things that we have to do if we want to solve a problem is get proximate, right? We have to get close to it. And when we get close to it, right, if it's a real problem, we're going to get uncomfortable. And that is, I think, honestly, the hardest part of my job is bearing witness to suffering, bearing witness to trauma and adversity, and not turning away, right? But being there long enough to understand the problem deeply enough so that we can actually do something. And I think that it's true of adverse childhood experiences. And I also think it's true about racism in American society. I think we all need to take a step closer to be able to understand it well enough so that we can start to figure out how to break the cycle.
We can't fix it if we don't see it.
Yeah, that's right.
So walk me through the list of what you look for in terms of sort of an ACE number. That was the aha to me, like, oh, darn.
Yeah.
That applies to a lot of us.
Yeah, so this is very interesting. So the original adverse childhood experiences study was, as I mentioned, conducted by Kaiser Permanente and the CDC. And they asked adults about 10 categories of what they called adverse childhood experiences. And those include physical, emotional, or sexual abuse, physical or emotional neglect, or growing up in a household where a parent was mentally ill, substance dependent, incarcerated, where there was parental separation or divorce, or domestic violence. So those are the 10 traditional ACEs. And one of the things, like as I mentioned, racial discrimination wasn't in there, right? And what's interesting about it is that the population where they did the original study, that population was 70% Caucasian, 70% college educated. And I highlight that often when I talk about it to help folks understand that when we're talking about, 62.7% of Californians have experienced at least one adverse childhood experience. That's all of us, right? It's not, I think sometimes we think about it in terms of vulnerable communities or folks, in certain demographics, but that's all of us. And it really shows how fundamental the biology of adversity is, right? Like this is just what happens in our bodies when we're exposed to significant stressors. Because what this study showed was that folks who had 4 or more adverse childhood experiences were twice as likely to have heart disease, right? Were more than twice as likely to develop cancer, were 11 times as likely to develop Alzheimer's, were 30 times as likely to attempt suicide. And so we see that the outcomes are both what we traditionally think of, right, as physical or medical, as well as mental and behavioral.
So once you have this information, I guess the question is, what can you do? And you've talked a lot about early intervention. So what are some things we can do to raise these children up?
Yeah, so for example, California's initiative to screen both children and adults for adverse childhood experiences. There are a couple fundamentals that are just really informed by what the science tells us we can do. So number one is that because we know that the fundamental biological problem is overactivity of the biological stress response, right? And so a lot of the interventions, so step one is just recognizing that and helping people to recognize, because of what I've experienced, my body may make more stress hormones than it should. And that can look and feel like, you know, getting sick easily when I'm overwhelmed, right? Or being, you know, quick to lose my temper, or having difficulty with impulse control, right? Or even craving things like, you know, one of the things that we find, one of the parts of the brain that's affected is the part of the brain that is the pleasure center, the reward center of the brain, right? And so for folks who have experienced high doses of adversity, then when they experience subsequent stressors, they might be more likely to crave things that trigger that activate that part of the brain. And I think of it myself, like whenever I'm stressed out, right? You know, getting to the bottom of a pint of Haagen-Dazs seems very appealing, and I can tell. I'm like, oh, that's my stress response. So I'm, you know, it's triggering me to want more high sugar, high fat foods, right? But
yeah,
also
100%.
Yeah, exactly, right? It's really funny. But then also recognizing, oh, so here's what I do. Exercise reduces stress hormones, releases endorphins, that also triggers that same part of the brain. So you can replace, you know, the activation of your reward center with junk food, with activating your reward center with things that are more healthy for you, right? Like exercise, like altruism, believe it or not, doing things for other people, right? Doing nice things for other people actually also triggers our reward center. So it's things like that, things like mindfulness, like meditation, that also helps to reduce stress hormones, reduce inflammation, which we, you know, recognize as part of an overactive stress response, is overactivity in terms of inflammation, and enhances what we call neuroplasticity, which is the ability of one brain cell to make a new connection to another brain cell. So there are lots of things that the science show us, right? Sleep, exercise, nutrition, mindfulness, mental health, and healthy relationships are some of the key interventions that can help to regulate the stress response. And these are some of the things that we can do. But the most important part, frankly, is just to recognize what's going on in the first place. Because I think most of us, and I'll tell you, I certainly didn't before I started reading this research, most of us don't recognize that our history of adversity, our history of trauma can make us can put us at greater risk for health problems, and can also make us more vulnerable to subsequent stressors, right? And when we know that, right, knowledge is power. And so when we know better, we can navigate the situation better.
And I wanted to ask you about self-care in particular. So thank you for that. Because I know you're working from home with 4 boys. So how's that going?
It's not easy. But in a way, you know, I have to say, I think through the COVID pandemic, I think we spent a lot of time in our household focusing on silver linings. And so one silver lining is certainly the fact that I get to spend more time with our kids, and that is really joyful. Trying to get work done during a busy day can be challenging, but honestly, number one, I have an amazing partner. Like, I don't know if you remember, Anne-Marie Slaughter wrote an article in The Atlantic like a handful of years ago. And I think the title of the article is Why Women Can't Have It All, right? Do you remember this? And she was talking about it. It was like an earthquake, that article. It was so powerful.
What?
But one of the things that she said was that our choice of partner is one of the most important decisions that we can make. And I think that's certainly been true in my life, because my husband not only does more than a fair share of the homework around our household in terms of caring for kids and, making dinner and, bath time and all of that kind of stuff. But he's also been an incredible mentor and mentor to me and champion for me. And he has been, I come home at the end of a day and I might tell him something that's going on. And he has been the one, he's like a raging feminist. It's really funny. He'll say, he'll be the one to point out to me, hey, what happened in that meeting that you just told me about? If you were a male CEO, that would not be the dynamic, right? Or if you were a male executive and you were sitting around that table with the other people, he says, I've been, he's been a CEO. He's like, in my 25 years of leading companies, no one's ever said that to me, right? And he encourages me.
Isn't that interesting?
Oh, yeah.
I just think it's fascinating that a man would point it out, because I think a lot of times we don't see it. It's just normal to us. Fill in the blank with those things.
Yeah, I think that's absolutely right. And it's really, I've been very grateful to have the benefit of his perspective and saying to me, no, stick to your guns. What you're doing is right on. You've got great instincts. Keep doing what you're doing.
So also, as a mom of 4 boys, I have to ask you about conversations you may have had with them since the George Floyd death in police custody. And your kids range in age from, little to teenagers who are probably more out there in the world now. So what has that been like for you?
It's been mixed. I think the experience of having the talk with your kids is a rite of passage that every Black parent unfortunately has to go through. And it's terrible. I'm gonna just go ahead and say that. It's terrible to have to say to your kids, because of racist beliefs, you are less safe out in the world than others. And I'm very careful not to say, because of the color of your skin, you're less safe out in the world, because it's not because of the color of their skin. The color of their skin is fine. The color of their skin is beautiful. It is the racist beliefs that targets the color of their skin. That's the problem. So that is really important to me, to have that conversation in that way. But the other piece of it also is really helping kids to make meaning of this moment, and then also helping them understand what they can do about it. Because that's the piece that feels, it takes it from being just an awful experience of explaining to your children that they may be less safe in this world, to really helping them to understand why it's so important for us to stand up for vulnerable peoples, why it's important for us to stand against all forms of discrimination, why it's important for us to raise our voices anytime that we are in positions of power, and to recognize what our power is, right? And that's what I tell my kids all the time: you are powerful. And so that is, I think that's what helps me get through some of these conversations. But I wish I didn't have to have them.
You hit on something that I think is so important, because you feel like much of the rage right now comes from a sense of powerlessness. And the antidote to that is certainly taking action. And there's something literally every one of us can do.
Yeah. So I have been having conversations with friends of mine who are Black. And one of the constant through lines of these conversations have been how much racist abuse we've all endured. And the fact that we have taken the pain from that, taken the hurt from that, and put it in a box. And we put it in a box for our own survival, right? Because we've all been told and we've all been conditioned that talking about race and racism is uncomfortable, right? And so we shouldn't do that. And we are seeing now, and one of the things that I feel really grateful for in this moment is that kind of tacit agreement that we don't talk about race and racism seems to be gone, right? Like it's out the window, which is one of the first most important steps to changing some of these systemic and structural dynamics. But the other piece of it, right, to your point, just as my husband, who is a man, called out so many of the dynamics where there was injustice that and not only encouraged me, but one of the things that his words did was they empowered me, right? For him as a seasoned CEO to say to me, "You're an excellent CEO. And you're doing a fantastic job, and don't you dare take any of that nonsense from anyone." And that empowered me. And I think that is in the same way, I think that all of us, everyone who is looking to be an ally in this moment, I think it's really important for us to recognize that racism is about power. So if we want to defeat racism, one of the most important things that we can do is empower people of color, right? And that's something we can do in a million ways.
One of those, this just leads right into, because we're about to open it up to questions, but leads so right into mentorship, which is a big part of She Shares. And so before we open it up to questions, my last one for this discussion is just if you can talk about the power of mentorship in your life, and also for kids who have a higher ACE score, one of the proven things that can help is something called buffering, which anyone can come in and serve as a mentor there. So let's talk about both of those.
Yeah, so I'll start with the second one first in terms of the research and the science on buffering is so powerful. And that's one of the things that also keeps me hopeful and keeps me joyful in this work. And it turns out that when we have these safe, stable, and nurturing relationships, right, that they actually, so when something scary happens with one of my kids, right, they're playing on the playground, they have an accident, they run to me, they're crying, right, instinctively as a mom, one of the first things I do is just throw my arms around them and give them a hug and let them know that they're safe and that they're okay. And interestingly, some of these things that we do intuitively, it turns out have really strong biological underpinnings. So what that does is that releases in their body a hormone called oxytocin. Every time I hug my kids, it releases a little bit of oxytocin. And oxytocin literally biologically inhibits the stress response, right? So biologically, that's how these safe and stable and nurturing relationships, they release a cascade of processes in the brain and the body to help to arrest the biological stress response. And that's really powerful. And that's why programs like, for example, the CASA program that we have here in California, where you have kids who are at known risk, right? Who are going through our court system, and CASA stands for Court Appointed Special Advocate, where they have someone who is just there for them, who's just looking out for them. And what the science and the research shows is that having someone who's just looking out for you is actually really important for improving outcomes. So that is really, it's really powerful. It's powerful science. As a mom, I try to do as much buffering as I can for my kids, and in terms of even making it through these challenging times, right? Like, I recognize.
Don't you feel like it goes? Well, I feel like when you were talking about it, even the playground experience, it goes both ways, because we're stressed too when our kids are stressed.
Yes, it's totally true. And in fact, my 8-year-old at this point, he so knows that hugs help when you're stressed, that there have been days where I've like come home from a long day at the office and he'll look at me, he's like, Mom, I think you need a hug. And like, he'll come, and I'm like, I do, it feels great. I feel better. So that's really wonderful and really amazing. And to speak to your question about mentors, I feel very grateful that I have had some wonderful people who have really helped to empower me and to support me through the years. Many of those, I think, many of my mentors, I mean, men and women, I have to say, our first partner, Jen Siebel Newsom, has been a wonderful friend and partner to me. Maria Shriver has certainly, she's really done the example of empowerment, right? By using her influence, her position, her platform to, and reached out to me, right? And given me opportunities to develop my voice and to develop my own platform. And this is how we lift each other up. But yeah, both women and men have been powerful mentors to me, and I do my best to pay it forward.
I love that, and I've actually talked to Maria Shriver about some of these issues, so I just love hearing it in practice, these things that she's talked about for a long time. So this first question comes from, looks like Rokio, and writing, what is your favorite memory so far of being California's Surgeon General, and what are some of the challenges and opportunities you've encountered?
So I will say that I think it was earlier this year, I had the experience of I was honored by a group in the East Bay in Oakland called Kidango, and they honored me with the Superhero Award. And when I went there, I had the opportunity to see the amazing program that they're doing, providing early childhood education and mental and behavioral supports to vulnerable communities in Oakland. And when, a lot of the work that I do, there are photo ops and there's cameras and that kind of stuff. But we had one session where I met with a bunch of the educators there, and it was no cameras and it was closed to press. And we just had a conversation, and we talked about trauma. We talked about the work that Kidango was doing to support kids in Oakland, and how each of the folks who were part of that program had come to it and what they were trying to accomplish. And they had me bawling. I was crying so hard to see their beautiful work and their commitment. And the kids made me a book and all of the kids in the program drew a picture and dedicated it to me, and they called me a superhero, and I was crying. So I would say that's certainly one of my favorite experiences so far. And the other question was, what was it?
It was challenges, but I'm looking at the time, and if you want to talk about that, we can. A question came in that I think is so important from Rochelle, asking how can we address the stigma within Black and Brown communities when we talk about mental health? I think that's a big one.
That's a great question, and that's something that I have been really passionate about for quite some time, because there is stigma in our communities, and I think that one of the important things that we can do is keep talking about it. We see more and more and more folks being open and speaking out. I certainly, in my role as California's first Surgeon General, there've been a couple interviews where I'm like, oh yes, when I talk to my therapist, and people are like, oh, she admitted it, and it's like, oh my goodness, how can we not? And I think that we're taking it on more. I think that we are taking it on more as a community and as a society. One of my favorite television shows is a show called Insecure. And for anyone who watches the show, you know exactly what I'm talking about. It's Issa Rae. She's brilliant. And one of the things that's so beautiful about the show is that they show lots of different types of Black people, right? So it's not just one kind of stereotype, but you have like the insecure girl and the nerdy girl and the professional person, and all different. And they have this conversation after the show. And someone made a comment where they were discussing, it's called the wind down, where the actual people talk about what happened in the most recent episode, and their experience of framing it and shooting it and telling the story. And I won't give anything away, but apparently one of the characters has a mental health issue. And they were talking like, how did you feel representing that, talking about mental health issues, especially in the Black community? And the character, the actor said, I don't see how you can be a Black person in America and not have a mental health issue, right? Something along those lines. And I was like, that is so powerful. That is so powerful. And I think recognizing that, there's hope. Like, that's not the end all and be all, that there are effective treatments, and there's a lot that our community can do when we are able to begin to move past stigma.
Right, that this is just part of a human experience that so many people are just all sharing. Megan writes, I work with juvenile justice youth in San Diego. Any advice for how to encourage youth to participate in therapy to overcome their ACEs and trauma when they're often resistant to system involvement?
That's very understandable. And I think part of it begins, I think, the first step to a trauma-informed approach is recognizing the ways in which that's valid, right? Recognizing the ways in which that folks who have been harmed by systems, right, may be hesitant to engage with something that feels, again, like the system. One of the things that I say to the teenagers that I work with when I was in clinical practice was, because of what you've experienced, your body may be making more stress hormones than it should. And that's normal, right? That's actually your body trying to protect you. There's so many young folks, and especially young folks who are involved in the juvenile justice system, they've been told that they're the problem, right? When we look at the data about the juvenile justice system, like study in Florida showed that justice involved kids, 50% had 4 or more ACEs. 90 some odd percent had at least 1 ACE, right? So we're talking about communities that have, if you're dealing with justice involved youth, they've experienced very, very high levels of trauma. And so step one in any kind of trauma-informed approach is really going to be establishing safety and helping them, making sure that it truly is safe for them to engage, and helping them understand that this is a safe place, right?
And this is somewhat related, I think, in terms of kind of overcoming some of these obstacles. And this is our last question from Renee. How can providers tackle traumas in a 15-minute visit? And what is the nurse's role? Mm-hmm. So we get these kids in and we do the assessment.
I feel like that was planted. That was perfect. If you want to know the answer to that as a provider, tune in tomorrow at noon, our ACEs Aware webinar. Yours truly will be walking through the fundamentals of ACE screening in primary care in pediatrics with some other clinicians who have been doing this work for some time and are pretty experienced. But the answer is you don't have to boil the ocean in one 15-minute visit. Short answer, I strongly recommend using the de-identified screening tool, which is what I used in my clinical practice. And that allows you to understand how many ACEs your patient has experienced, but not which ones. And it allows it to, take off approach the issue in a little bite-sized container. And then you recognize, okay, the score is a 2 or 4 or 6 or 7, and you can still counsel and give advice to your patient, right? And recognize that the next step is to begin unpacking that de-identified score in a more structured environment. And whether that is connecting them to a mental or behavioral health clinician or a social worker, or if you don't have access to those things, bringing them back and say, okay, we're going to start to unpack this at your next visit, and we're going to schedule a visit to start talking about how this may be impacting your health, and really making that connection to, again, not just our mental health symptoms, but also those physical, the ways in which this trauma and adversity affects our body physically. And then just going from there, just baby steps.
And to be an advocate from that place. Dr. Burke Harris, thank you so much for your time and being part of this She Shares conversation, and having a Surgeon General during a pandemic, the fact we're doing this virtually. One of the advantages, though, is that so many more people could be part of the conversation. I think we had more than 1,000 people register, which when we're all in one room, we can't do. So you talked about silver linings in your home. It's been so wonderful to talk to you, and just thank you so much for the work that you do. And I'm going to hand it back now to Tamara Torlakson.
Thank you.
Thank you, Edie. Thank you, Dr. Nadine Burke Harris, for joining us in that wonderful conversation. It was so great to hear from you. This conversation will be posted on our YouTube channel, so you can share it with your colleagues and friends. So please do that. And we will also go ahead and get the link to Dr. Burke Harris's conversation she mentioned tomorrow, and I can share that with all of you via email so that you can tune in and learn more about what she's doing. All right, thank you all so much. Stay tuned for announcements on future events. Have a great day.